everyone, my name is Mannat. I worked on the Be the Conversation study team as a research coordinator, and I'm going to talk to you today about some of our key findings in relation to the trans response team priority work areas. Be the Conversation was a community academic partnership between the TRT and the Hopkins School of Public Health. We started with a formative qualitative phase in 2015, the goal of which was to inform the development of our eventual needs assessment survey. So we conducted 20 in-depth interviews with trans community leaders and activists and local health and social service providers. The interviews focused on community priorities and needs and how to engage ethically and respectfully with trans Baltimoreans for research. In March 2016, we launched the online BTC survey. Individuals whose current gender differed from their sex assigned at birth, who lived in Baltimore and were 18 plus years, were eligible to participate. We used numerous recruitment methods, and some examples are listed here. The survey also covered many aspects of people's day-to-day lives, from HIV and STIs to mental health, access to gender-affirming services, and so on. Now, getting into findings, one goal of the BTC study was to conduct population size estimation using the wisdom of the crowd method. So this involves asking participants to estimate population size based on their own perceptions, and then we determine the median estimate. So for context, the Williams Institute estimated that over 22,000 trans people live in Maryland, and BTC participants estimated that around 2,000 trans people live in Baltimore. Hopefully, useful context for future programming. This slide provides a brief overview of participant sociodemographics, and I'm going to highlight a few key points. So 141 trans and non-binary Baltimoreans participated in the study, and the mean age was 35. 65% of the sample was trans feminine, and 35% was trans masculine, but participants reported a diversity of gender identities, and in fact, 21% selected more than one gender identity. In terms of race ethnicity, around 50% of the sample was Black or African American. Notably, we see prevalent socioeconomic needs, including housing, lack of income, unemployment, and food insecurity. Around 14% of participants also faced challenges when trying to access gender-affirming care in the past 12 months. Now, this slide really speaks to the heart of the BTC study, which is to explore community priorities. Participants were provided a list of priorities based on what we heard during the formative phase and asked to select their top 5. And as you can see, the most commonly selected top priorities align with the TRT work areas. We also wanted to highlight that access to transgender-sensitive healthcare was a top 3 priority endorsed by almost 40% of participants. We hope this graph can ground the rest of our presentation because, as suggested in this quote here, the conversation about needs really belongs to the trans community, who have long faced non-community members defining their needs and programming for them. And as you've heard, the TRT priority work areas focus on violence, sex education, and access to employment, and I'll talk through some of the BTC data related to these topics next. So we'll start with violence experiences. Among BTC participants, 3 in 5 had experienced some form of violence in the past year, and the majority attributed some or most of these experiences to transphobic discrimination. Preventing violence and harassment perpetrated by the police in particular was selected as a top 5 community priority by 38% of BTC participants. And relatedly, we have a lot more to learn about common perpetrators of violence and context of violence exposure, which may vary by trans subpopulation or community. The graph below depicts data on recent violence experiences by sex assigned at birth. So evidently, psychological violence in the form of verbal insults and abuse was pervasive across groups. Trans feminine participants were especially vulnerable to property destruction and physical violence, and around 10% of participants had actually moved to escape violence in their homes. Experiencing violence in the past year was also highly correlated with adverse mental health outcomes like suicidality and PTSD. Importantly, there's a need for more research that focuses on violence impacts for trans men and non-binary individuals. This was actually one of the first local studies to collect that information. While targeted efforts are needed to address groups that are disparate risk for violence within the trans community, like Black trans women, it's also crucial that we work on targeting city-level transphobia as a determinant of violence and take a population approach going forward. Now, getting into sexual health experiences, while this wasn't the focus of the BTC survey, we asked participants about HIV testing and to self-report their status. As shown, around a quarter of trans feminine participants reported they were living with HIV, and almost 3% of trans masculine participants, which aligns closely with national estimates for trans men. In recent years, local trans men leaders have again highlighted the need for research that centers their sexual health needs and embraces their sexual diversity. I've also boxed off this data on HIV status by gender identity to highlight that we see differences when we disaggregate by identity instead of sex assigned at birth. It's important to consider how people's lived identities are impacting these experiences related to sexual health. With this next graph, we've broken down lifetime STI history by sex assigned at birth and gender identity, again, leading to slight differences. We see varied STI experiences by gender, which highlights the importance of offering tailored programming that doesn't assume all trans people are having the same experiences in relation to sex, but instead creates room for assessing unique needs, not only by gender, but also based on intersecting identities. During our qualitative formative phase, program leaders and health and social service providers shared helpful advice for building programs for trans communities, including sexual health programs, as summarized in these quotes here. One important factor is the reality that survival day to day can outweigh health. It's not only important for programs to consider this, but to think about how they can demonstrate responsiveness to participants' holistic needs. Key informants also highlighted that unless programs are explicitly inclusive of trans individuals, underserved communities like the trans community may assume that the space will not be safe for them. And this has important implications for program communications and advertising. Key informants also felt that because current programs are often centered around specific health issues, this can lead to unintentional exclusion when certain groups don't feel that the issue applies to them. So lastly, as we see here, there's widespread distrust of formal organizations, especially for trans people of color, in part because their needs have not been prioritized, and also because they don't see themselves reflected in organizational leadership or staff. And finally, I'm going to talk a little bit about employment experiences. Among BCC participants, 2 in 5 were unemployed and 3 in 5 were living below the federal poverty line. Around 13% actually reported they were fired from a job or denied a job or promotion they were qualified for in the previous 12 months. So it's clear that lack of access to employment and stable employment in particular is a crucial community need. Key informants also noted that hiring trans staff at organizations that are serving trans people can improve the community's access to these services and how affirmed they feel using them, which represents both an opportunity for employment access and program success. And finally, we summarized some key short and long-term recommendations related to development and implementation of gender-affirming programs and services. So on the short term, programs need to reach out to trans communities in diverse ways, especially to build trust. Explicit inclusion of trans communities and enacting cultural competency practices are crucial to ensuring that trans people feel safe. And long-term, we need to be hiring trans leaders to build and lead sustainable community-grown programs. Cultural competency should become an organizational value in order to prevent discrimination and maintain trust. And finally, programs should center capacity and skills building curricula to ensure that we're working towards community empowerment long term. Thank you all for listening.